This is 6th grade health. We are going to do page 41 to 46 because that's like one section. I think that'll be easy to do that way. So obviously in 6th grade you probably haven't really had much formal medical training, but we've talked about a little bit how important it is to know, because you never know what situations may arise, how to handle things. And remember, we talked about no matter what, try your hardest to stay calm, to come up with a plan of action, get help of some sort, and then execute, whatever you need to be doing there. So obviously blood is really important. We have to keep it in our bodies. It transports our oxygen all over the place. And so a person could bleed out or bleed to death very quickly. So one of the most important things you need to understand about is how to stop bleeding. Now remember, we talked about having a compound fracture and a simple fracture and how you don't apply pressure on something that's broken. But other than that, if they're bleeding, you want to be able to place a clean cloth, as clean as you can find at that time, folded over the injury, and then apply a little bit of pressure. Now, when I'm thinking pressure, normally I show you that kind of pressure when we're at school, but I want you just to understand that it's not like pushing down super, super hard. It's just applying a little bit of pressure. So, I really wish I could think of a way to, I'll just show you when we get back, a way to explain like how much pressure to put on. Anyways, if the blood soaks through that cloth, then you don't remove that cloth because it could be clotting underneath. You put another one on and then you put that down. Also shows when emergency medical technicians or paramedics or whatever get there, it shows them how much they've actually bled. So you want to keep that on there. Page 42, you want to try to elevate the injury. Remember, we talked a little bit about that before. You want the blood to stop rushing to that area. So if it's on your arm, you would want to raise their arm up above their heart rate, or heart, not heart rate. If it's the leg, they want to lay them back, let them try to elevate it above the heart to where it would slow the blood loss as much as possible. And then you need to know your pressure points. And this is probably one thing that you definitely want to look at. You have a worksheet on it that you're supposed to be doing as well. But you want to know the major pressure points and the major areas of arteries. So if you look at on page 42 there, this little guy here. So they're showing you how some of these major arteries are here. And I know it's backwards to you, but anyways, the carotid artery would be in the neck area. The temporal artery is here at the temples there. And then you've got the brachial artery, which would be up here. There, the radial artery is going to be down here. Then you've got the femoral artery, which would go, be around in this area here. So your pressure points, the major pressure points, you've got, the temporal artery. You don't really use that as far as applying too much pressure. But your carotid artery is in this area. Let's say that you have a cut right here on your arm, then you would not want it to come from your heart to through the brachial artery. So you would apply some pressure on this artery to try to stop the blood flow to this area. The only time you would really do the radial artery is if it's a hand injury. And if it's a leg injury in any sort, then you would apply that pressure here, to try to stop the blood flow as much to the femoral artery there. So those are your different arteries, and of course you've got the worksheet that you can do that. So you want to know your pressure points and where to be able to apply that. All right, so then head injuries, of course, you don't want to move their neck or their head. Try to stabilize them as much as possible, and then of course call for medical help. Try to stop bleeding as much as possible, keeping that clean bandage on, trying to stop the blood flow there. Brain damage, obviously, that's something a little bit beyond our fields of expertise at this point. But you, again, want to realize the difference. There's a concussion. That is a jostling of the brain inside of your skull, inside of its bony covering there. And the concussion would be where it's kind of shaking, the doctor will check your eyes and that kind of thing. A lot of times they just want to like keep an eye on you with a concussion. You don't want to have too many of those, but really don't have one, but you know what I'm saying. A contusion is a little bit more serious because the blood is rushing to the brain. And a bruise is a contusion, but a contusion to the brain, that would be bruising of the brain. Multiple bruises to the brain, and that could cause bleeding, which could cause brain damage as well. Multiple concussions can cause brain damage as well. And then on page 44, a person that stops breathing for a number of reasons. Maybe they were drowned, maybe they had electrical shock, maybe heart failure, poisoning, maybe a blocked airway, suffocation. So rescue breathing is used often, or artificial breathing. And one of the most important things you can do is become trained in CPR and first aid and learn how to do those types of things. You can see on the bottom of page 44, you want to be able to provide an open airway as soon as possible. Placing the victim on their back, tilting their head back, up, and so on and so forth. You can look at these pictures and read about that as well. Choking, people will use the Heimlich maneuver. Now, I want you to understand the difference between choking and just kind of getting a little something in, aspirating something into your lungs. So let's say somebody takes a drink, they're drinking something, and somebody laughs, and you go, when you drink. You get a little bit of that in your lungs because you have two holes at the top of your mouth or top of your throat there. One's the esophagus and one's a trachea. The trachea is your breathing tube that goes into your bronchi, your bronchioles, your lungs. The esophagus goes straight into your stomach. And so there is a flap over the trachea that's called the epiglottis and glottis. And those kind of help protect us from getting food and drink and that kind of thing into our lungs. Well, occasionally, if we go really quickly or something weird happens, we will get something stuck in that flap, or we kind of aspirate some things. That means breathe it into our lungs. And so if someone's coughing, let them cough. They might be coughing so much that they almost throw up, but that's okay. They're not choking if they're coughing. All right, they're getting it out, they're coughing it up, and they have enough air in their lungs to where they can cough. Now, if they're choking and they got something completely stuck and it's a blocked airway, then they're going to be like, and they're not able to cough. Okay, you get the point? And so if that happens, then we'll talk about this a little bit more later, but basically the abdominal thrust, or they used to call it the Heimlich maneuver, you'll take a fist kind of right up underneath the ribs. You want to be careful not to put it right at the ribs because you could break a rib. And then you're going to kind of go up and in to the diaphragm. Because remember, the diaphragm's that muscle sheet that lays underneath the lungs. And what we're doing is you're pushing that muscle into the lungs, causing the lungs to kind of go like that to get out whatever is stuck in that trachea. And so it will, usually when someone does the Heimlich maneuver, my dad had to do the Heimlich maneuver years ago. And when he did, save a life there, basically. But that piece of whatever was stuck, went across the restaurant, That's okay, because you just saved a life and everybody cheers and, that's wonderful. But you do have to be cautious in all of that kind of stuff. And hopefully someone who's been trained and certified will be able to do that. As well. But do understand the difference between choking and and then just, coughing and being able to, getting something, just a little bit of something there, like in there. If you continue to cough for days, or a while, like because you've gotten something in there, you may want to see the doctor about that because you might have something little down there in your lungs or whatever. All right. So that is 41 to 46. And, we will continue on another day. Have a good day.